Tonight's World in Action deals with conditions in a mental hospital. Some people may find this distressing. Powick Hospital near Worcester, built like 100 others in this country by the Victorians for their lunatics. Today the high walls have been torn down. With modern drug treatments, most patients stay only a short time. But some stay forever, here, in these barrack blocks known as the Annex. Some have been here 40 years. Some younger ones have 30 years or more to go before they die. The Annex and the state of the people who live here are appalling.
Come on, Annie. Up you go.
Conditions like these exist in many but not all mental hospitals. Most comparable institutions would prefer to stay hidden. Powick didn't evade our inquiries, and the decision was surprising. For the hospital is ashamed of the Annex, and the conditions here are not wholly due to lack of money. In dealing with the problems, Powick seems to have become infected with the hopelessness of the Annex inmates. This is a record of one day's events in the worst ward of the Annex, Ward F13. Dr. Arthur Spencer, the medical superintendent, on conditions in his own hospital.
There are two possible reactions, I think, to your visit here. One is that people will become incensed about some of the members of the community having to live under these conditions. The other possible reaction is that people will be so appalled at what they see that they will shut it out of their minds and reject the whole problem as being insoluble and something which they can't face up to.
F13 stands for Female 13, an appropriately chilling title. They say if you don't die on 8, you die on 13. The patients are all female geriatrics. Some are physically ill, others are simply very old, shaky but still aware. Most are incontinent. You breathe urine all the time you're there. There are 78 beds, only inches apart. The baths are ancient and chipped. The edge of a lavatory seat is so worn it would scrape old skin.
Well, it's a perfectly average mental hospital, similar to about 100 other hospitals in the country. It serves an area, namely mainly most of Worcestershire, and we receive here all the patients in that area who suffer from any form of mental illness and whose illness is of such a degree that they need hospital treatment.
7:30 a.m., setting off to face the day which they started by sitting publicly on a pot, most without their teeth in or their specs on, most in hospital clothes and hospital underclothes, which were on someone else last week. Some wear name tabs on their wrists. Many have pudding basin haircuts. They are stripped bare in front of each other. Their bottoms are wiped in front of each other, and that, apart from feeding, is nearly all that happens to them.
Many of our long-term patients came in to the hospital before the days of very active treatments. They suffered from various diseases, but in addition, of course, they then became subject to the kind of life that lead in an institution like this. And at the present time, if one takes our very long-stay patients, it's extremely difficult to know how much of their condition at present is due to their original illness and how much is due to the institutionalization to which they've been subject since.
There's a television, a radio, and a piano. All day the old ladies just sit. Some of the nuisances spend hours locked in chairs like babies' high chairs. But most no longer have the energy to be even a nuisance. They're what's officially known as institutionalized.
One comes to accept the surroundings, so a thing one can't alter.
Do you think you can do sort of good nursing in these sort of conditions?
One can do one's best, that's all we try to do.
It is second best though, isn't it?
Well, it is second best, yes.
If one of my relatives came here, I wouldn't feel at all happy about it. And you found this with relatives, haven't you? They
Yes.
What's the reaction of many relatives coming here when they see it?
The reaction is partly guilt, but why should this happen to me? What have I done to deserve this? Or what's happened to my family sort of style? And the other idea is that they're terribly ashamed of letting the neighbours know that it's happened to them.
It's your birthday, Mrs. Wilson. A birthday card from Ellen, Kate, and Edward. To dear Mother with all our love. Yes, it's your birthday, darling. Yes. Isn't that lovely? There. Isn't that beautiful? You going to keep it in front of you? There you are, my dear. Isn't that lovely?
A modern admission ward, 150 yards from F13. Here they work miracles with a Victorian institution. It's in wards like this that the main body of the hospital's work is concentrated, treating and curing short-stay patients.
Good afternoon.
Good afternoon, Doctor.
How are you feeling?
Oh, very well, thank you, Doctor.
Now, you've just come into hospital, haven't you?
Yes.
There is no smell. The colours are bright and modern. There are vinyl tiles on the floor. The atmosphere is hopeful and attentive. The treatment of short-stay patients eats up the money. Shock therapy, analysis, hypnosis, surgery, occupational therapy are all available, and Powick has made a name for itself in pioneering the use of LSD treatment. Once patients reach the annex, the battle is virtually over. The institution closes in around them. Powick's policy is to stop them getting there at all costs, and that leaves little for the people in F13. This is an occupational therapy unit. 150 yards away, the long-stay patients are left to vegetate until they no longer know how to do anything else. Powick spends £700,000 a year, most of it in an effort to get their short-stay patients home. It provides them with amenities it says it cannot afford for F13. Here, people are still people, women still women.
Nice light shirt. You don't want too much because you've got a very fine skin.
F13, lunchtime.
I did not want chances.
You've got to have some.
I shall not.
You're going to have some.
Yes. Are you? I have good
Come on, darling. There's a good girl. Come on, baby, sir.
No, you won't have them. Oh. No, Mary, I don't like it.
Why not?
Because I think it's too much. All right. Turn your shoulder. Will you sit in your chair? Well, you need to just over here and it's better. Look, you don't hear something. Won't make a from. Oh. That's my pen, that is.
Dr. Vijay Das, the ward doctor.
This part of the hospital is the bin, and people don't take too much interest in it, and somebody has to take a lot of interest to do things in this part of the building. But it is really terrible, and one of the diseases which we get often here is scabies. There has been a sort of endemic, all the time scabies going on in this hospital, and often about 20 or 30 patients in each ward. Just a few days ago, in the next ward, there were 20 patients of scabies. And this happens due to very poor hygienic conditions and overcrowding. It is often seen in the Oriental countries where there is very poor hygiene and overcrowding, which we see in this hospital, which shouldn't be there at all. And there is very few facilities for bathing to the patients. There should be showers in the hospital. There are baths in which 2 or 3 persons have to put a patient in and bath them, which is very difficult.
Well, this is England, and this is 1968. How do you feel as a doctor working in a ward like this?
This is really terrible, but I'm personally not working for a long time in this ward. I came only to work in this hospital for 6 months. I wouldn't like to work here anymore anyway.
Hey!
She's going to sleep. She's going to sleep. Mother, come on. Mother, have some tea. Come on. Come on, have some more.
A lot of the patients in this hospital who are in the elderly age group, they could be managed in their home, I think, by their families. It is only a process of their age. It's a normal process of aging that they get demented, they get confused, and they're incontinent, but they should be looked after in their homes as anywhere else in the world they are.
This happens in the East?
This happens in all the Oriental countries.
We could refuse to admit patients. And there are some hospitals which do so. Here we've decided on a fairly liberal admission policy. And as part of this policy, if any general practitioner in the area that we serve wishes to admit a patient here, he is able to do so as of right.
Do you think you ought to accept patients when you can't put them up in decent conditions?
Under the circumstances, we do, because knowing our general practitioners as we do, with their knowledge of the hospital, we can be quite sure that the conditions from which the patients come are, from the patient's point of view, less satisfactory than the conditions to which they're being admitted in this hospital.
You get hardened to it.
Tell me about getting hardened. What do you have to get hardened to?
Well, when you first come, it's a bit of a do to get into bed with a dormitory full of people. You can't rest, but you get hardened to it.
How long have you been here, Harriet?
44 years nearly.
You're sure on that, are you?
Sure.
What do you think of being in here? Do you like it?
I hate it.
Why?
Because it's hell.
Well, what's hell about it?
No one to speak to.
A lot of people here. Don't you have any friends?
No, you can't speak to them. They can't have a conversation with them.
Why is that?
They don't understand you.
The care and attention which the patients receive is perfectly adequate on a given level.
What given level?
The level of kindness, the level of adequate physical care. Those are the two main levels, as well, that one would speak of.
Is the level of becoming slowly a cabbage an adequate level of care and attention?
No, this is where one is unhappy about the situation, that long-term patients in hospitals like this do tend to become depersonalized through the institutionalization and the non-stimulating character of their environment in a way which is unnecessary.
The floors in certain wards are terrible. They are wooden floors which are really soaking with feces and urine, because those floors have been lying there for years, and one could easily put vinyl floors there, which would not involve a lot of money.
Well, why hasn't this been done before?
I couldn't answer that question.
You seem almost resigned to the state of these patients. Do you care about them?
My apparent resignation is a misapprehension on your part. One is not resigned to these conditions, but one has to make the best of them. And it's no good going around fuming with anger about conditions about which you can do relatively little. This doesn't do you any good, nor does it do your patients any good.
But surely anger gets things done. If you refuse to sit down under these conditions and fumed constantly, Surely something would be done.
No, it depends whether the right people are getting angry.
Well, you're medical superintendent of this hospital. Surely you are the right person to get very angry.
It's not much good my getting angry unless I can communicate my anger to the right people. And ultimately the right people are the people who happen to be looking in at this program, because it's out of their pockets that the money has to come to improve the conditions under which our patients live.
The conditions could be improved without money. It wouldn't cost anything to remove name tabs or to use the screens already there when stripping and potting old ladies. Society may be guilty in the way it treats its old people, but the immediate responsibility for the care of these patients and thousands like them in Britain lies with the Dr. Spencers and their management committees.
Within this outward appearance of complete depersonalization, there is still an inner core of the real person present. And if you get down and talk to these elderly patients, listen to what they've got to say with your ear to the ground, as it were, you hear far more than you expect to hear, and you appreciate that these patients are by no means as depersonalized and deteriorated as they appear to be on the surface.
If the real person is still there, don't you think that some of them may find the conditions there less tolerable than you seem to make them out to be?
Well, I hope I've not made them out to be tolerable, but after all, you know, people can get used to almost anything. And you could get used to living in the annex wards. There's no doubt but that the annex should be pulled down. It's never built for the purpose it serves today as an active, or seeks to serve as an active psychiatric hospital. Say it was built for pauper lunatics. It cannot by any stretch of the imagination be made suitable. And the only thing to do is to pull it down and build in its place small family-sized units containing perhaps 12 or 15 patients, where those patients can have the individual and personal attention that they need.
Well, this building is now 100 years old and it's been unsuitable for a very long time. Why hasn't it been pulled down before?
Basically because the community isn't sufficiently interested in this matter to see that it is pulled down.
What plans are there for pulling it down in the future?
None, as far as I know.
Why not?
Well, here you come to the chain of events which really result in the conditions in the annex remaining as they are. Ultimately, these conditions are the responsibility of the community as a whole. To pull down the annex is an expensive job, rebuild it. There's just not the money available. But if the community as a whole had its priorities slightly in a different order from what it's got at the moment, the money would be available.
When do you think the annex will disappear or be brought up to standard?
The annex cannot in the first place be brought up to standard, and this applies to an enormous amount of mental hospital building, which we've inherited from the Victorians and which we've done nothing about replacing. This problem isn't peculiar to this hospital in any way at all. As to when the annex will be replaced, I don't know, nor do I think anybody else knows. We shall just go on and on as we are at present.